Hi, I'm Carissa Epling, and I'm here to talk about the world of X-ray. So I have worked in the X-ray world for 15 years now. I worked 10 years in diagnostic X-ray, and I have now been an angiography tech for 5 years. Radiology is a very rewarding career. There's lots of different career paths to choose from, and I feel like it's kind of hidden from most places. I know myself, when I first got into the program, I was not aware of many things that came along with being a radiographer. First off, there's two different types of degrees. They're both in radiologic science. You can obtain one that is associate's, or you can get a bachelor's also. At the end of each program, you will have to take a board exam by the ARRT, and it's nationwide. And then you also get a state licensure that you have to keep up with too, among different continuing education hours and stuff that's due every 2 years. So some of the specialties of, and everybody's probably mostly heard of these, because there's ultrasound, MRI, CT, and angiography, which is probably one that a lot of people don't know much about. I know I certainly did not when I took this job. First step to becoming an X-ray tech is finding an accredited school. Here close by in West Virginia, we have Southern, which I went to and graduated in 2008, or we have the University of Charleston, which I'm now obtaining my bachelor's after 15 years. There's certain classes you have to take, radiation physics, different positioning classes, and there's a lot of in-hospital clinical hours that also have to be finished. Working in diagnostic radiology, there's a few different things. It's a pretty interesting area. So you can work in the ER, so you see a lot of, different emergent type trauma stuff. You work in the OR, which is really neat. And then you can also work in fluoroscopy. And where I worked, you kind of rotated through each place on a day-to-day basis. So it kept up, changing it up every so often. As far as CT, I know a lot of people know about CAT scans, a lot of abdominal CAT scans, head CAT scans. It uses computerized X-ray imaging, and it kind of gets slices. So it slices, sometimes it'll do it this way, or you can change it and get sliced up and down to receive images, and kind of you go through the body looking each way. And it provides a little bit more detail than actual X-rays. And I mean, both are great resources for physicians. CT also kind of uses a little bit more radiation, so you want to be careful when they are choosing to use that. Then we have MRI. MRI is a big old magnet. It produces 3D images. And this is a little bit harder specialty to get into. There's not as big of a turnover rate because people kind of get in these jobs and they stay there, but it is always an option. Gray area, and it's similar, the images are similar to CT images. It's just using a magnet and computer generated radio waves to achieve this different image. And then we have ultrasound. Everybody knows ultrasound. It's very popular due to everybody wants to work with babies, but unless you're in just a neonatal unit or an OB setting, there are several different types of ultrasounds. You can get abdominal, breast, neck, different types of things. And kind of a subspecialty of that to go even further would be the vascular lab, where they look more at the deep veins and the arteries. And lastly, we have angiography, and it is a field that I love working in. You see new things every day, and what it is they use fluoro. And if you're not familiar with fluoroscopy, that is basically a live X-ray just going kind of like on a TV instead of just one image, like a chest x-ray or something you would see. So it's continuous, and they use what is called contrast, and it highlights the different vessels, and we can see if you're going down and the vessel tightens, then you won't see as much contrast. So we know, hey, this is the issue, this is why you're not getting blood flow, which most of our patients are diabetic, a lot of peripheral artery disease, and it's kind of a non-invasive procedure. While we do some surgical procedures, mostly it is non-invasive, meaning we don't have to open. It's just a percutaneous stick, and then we can reach from your groin anywhere else in the body. In our angiography suites, we do interventional radiology procedures, we do procedures with vascular physicians, and we also work with neurosurgeons, so they achieve the same goal. We do strokes, cerebral aneurysms, and they do the same thing. They enter through your groin and then go up and can get to your brain that way. So if anybody is interested in radiology, there's a lot of different options, very rewarding. You can also specialize in any board, so.